Classification. Classification according to the Garden classification system is a fundamental aspect of characterizing femoral neck fractures. This system categorizes fractures into 4 types based solely on anterior-posterior radiographs without considering lateral or sagittal plane alignment. Type 1 fractures are incomplete and typically involve valgus impaction. Type 2 fractures represent complete but non-displaced fractures, while Type 3 fractures are complete and partially displaced. Type 4 fractures are fully displaced. Pauwels classification. The Pauwels classification system provides a crucial framework for understanding femoral neck fractures based on the vertical orientation of the fracture line. Type 1 fractures exhibit an angle of less than 30 degrees from the horizontal plane, indicating a relatively stable configuration. Type 2 fractures fall within the range of 30 to 50 degrees from the horizontal, presenting a moderate degree of instability. Conversely, Type 3 fractures are characterized by an angle exceeding 50 degrees from the horizontal, representing the most unstable category with the highest risk of complications such as nonunion and avascular necrosis. This classification system serves as a valuable tool in guiding treatment decisions and predicting outcomes based on the severity of fracture displacement and instability. Hope you've enjoyed the video. Please subscribe for more interesting and informative presentations. Stay tuned for more videos. Take care.